Welcome everybody, my name is Tay and this is my company, Primary Holistic Integrative Center, and I also run the company called 5 Phases Acupuncture, and these are my credentials. And I've been in clinical practice in the town of Manhasset since 2008, 2009, somewhere around there. So I've been in practice for about like over 10 years. And this is my health disclaimer, is that this presentation is for educational information only and may not be regarded as medical advice or instructions. No action or inaction should be taken based on merely on the contents of this information. Instead, the readers and the viewers and listeners should consult an appropriate health professional on any matter relating to their health and well-being. So, take a deep breath in, and hope you find this fun, educational, and very entertaining. So this is a picture of your liver, and your liver has all of these functions that are important to the body. In fact, if you don't have your liver, you will not live, and that's how important it is. Unlike the gallbladder. Gallbladder, if they were to physically remove it through surgery, you can still live without it, and they work in conjunction together. But mainly, liver is there to the destruction of the red blood cells, formation of bile salts, metabolism, synthesis of plasma proteins, fibrinogen, prothrombin, enzyme synthesis, and helps you just detoxify, remove a lot of chemicals in your body, fat metabolism, and so forth. And it works with your gallbladder together. And if you look back over here, this little green thing that I'm highlighting right here is your gallbladder. So your liver produces these enzymes, and your gallbladder is there to store these enzymes. And it's pear-shaped, and the gallbladder is a reservoir for bile when it's not being used for digestion. And when you are digesting, it releases the bile salts and injects it into your small intestine. And it helps break up the bile helps break up the fats. It also drains waste products, and excess of cholesterol, bilirubin, bile salts can also form there. And that's what this presentation is all about. And that these gallstones get formed. And if you look at the gallbladder right here, these little stones gets formed. Right? And it's been known that these things have been around for a very, very long time because we eat oftentimes fats, especially vegetable fats or meat fats. And when they get cooked and we consume these fats, and just like all oils, they have a tendency to float up because they're less dense in the body. And as they float up from your digestive tract, it kind of goes into your liver and your gallbladder. And mind you, your gallbladder also pulls things in to suck up the excess bile salts. So as it pulls in, it goes into your liver and gallbladder. And if you happen to eat your meals late at night and then go to sleep and they happen to have fat in them, well, guess what? They're going to float in there because fat tends to rise. And this is another picture. And basically, this is empty, and then over a period of time, it gets sent into your gallbladder. Now, there could be a lot of complications that does happen. Chances are almost everybody that I come across have some shape or form of gallstones in their body. In my 10 plus years of doing these flushes for people, I have met maybe one person who have told me that they didn't pass any stones during the flush. So chances are this person may have large biliary ducts. Who knows? If that's the case, then those people hopefully will pass on those good genes, and maybe in future generations we'll have people without less of these problems. And these stones come in various different colors, and they mainly depend on what you eat, and that's pretty much it. And I found this picture to be the most, I got it from this website, to be the most comprehensive um, depiction of what's really going on in the body, because these stones are not only found in the gallbladder, but also found in your liver. And we see them in cadaver labs and stuff like that. And they kind of like clog up the system and prevents all kinds of things. Now, the weird thing about the liver gallbladder flush is that no blood work can find out that if you have this. The only way to confirm this is through a sonogram or possibly a CAT scan. I'm not sure about these scans, but I know that sometimes they can find it through CT scans or CAT scans. And I think sonograms? Yeah, sonograms too. Um, these stones, people have them, but not realize they have it because they're considered to be what they call asymptomatic, meaning they don't have any signs and symptoms. And the people that do usually have it on the right side of the chest when it gets really packed and full. And they feel like they're having a heart attack, and a lot of patients run to the hospital and they tell the doctor or at the ER saying, I'm having a heart attack. And these wonderful doctors, they run all of these scans and they find out that the heart is okay. And the last thing they scan is the gallbladder. And once they find out they have the gallbladder, a doctor usually comes out and usually tells them, hey, we have something very serious that is non-life threatening. You have what they call a packed gallbladder. And if this thing gets infected, you're gonna, if this gets infected, you can possibly die. So we need to go into emergency surgery right now and physically remove it. And when a person hears this, most oftentimes they go with the procedure and they physically remove the gallbladder. And they oftentimes have gallbladder digestive issues for the rest of their lives, and they got to take enzymes and certain things to live their life without a gallbladder. You can live a full life, but it's not going to be comfortable. And some people have it better than others from what I've seen in my practice. And I knew of this flush when I was in school studying this and the importance of it. However, I didn't preach it to a lot of my patients when I was practicing in the beginning. And I came to regret not pushing this to a lot of my patients because some of the two elderly couple that I was treating one weekend came back and said, Tay, I had my gallbladder removed. And I'm like, oh, I'm supposed to prevent this from happening. And since then, I usually put all of my patients, once I build trust with them about their health and well-being, that spring is the time that I usually get them to do something like this. And since then, I've been doing this, and I think I've done over like close to over 1,000 flushes, close to maybe 1,500 flushes. But then again, I'm not counting. Okay. The signs and symptoms of having your gallstones impacted can range from being asymptomatic, meaning not have any signs and symptoms. If these stones get lodged in your ducts, suddenly you have intensifying pain on the upper right portion of your abdomen. And people have a lot of pain, especially it travels to the right side. It's called a referral pain that travels from the right side of your chest to the back of your right side of the back, behind your shoulder blades. And some people experience nausea, vomiting. I had this one lady who had severe bloating. Every time she ate, she had bloating because the food was not being properly digested, and it was sitting there and rotting. And that rotting process created a lot of bloating and gas. And her, after doing this flush, she felt it was totally gone. Can this affect if you have a lot of stones? Yes, you can have fatigue, skin rashes, depression, hormonal imbalances, gallbladder disease, and the list goes on and on and on. And one thing I do want to focus on is the hormonal balances in the upcoming slides, how this affects your slides. And if you have these things, it can physically create these things, and some people can have jaundice. They start turning yellow in the body because they have too much bilirubin buildup. Some people, because it causes a lot of inflammation in the area, it causes them to have gallbladder cancer, blockage of the pancreatic duct. Yes, because the pancreas is right there, and sometimes these stones can be formed into your pancreas, and which also kind of plays into, if your pancreas is functioning to release insulin or glucagon, sometimes if it's blocked, your body can't process these things. So it creates a lot of these problems, physical problems. And this is what the stones look like when you poop them out, and you kind of clean them, and some people poop them out into a screen. I have never suggested to any of my patients to do these things. Some people have sent me pictures, but I'm not gonna post them on thing. You can find all these pictures on Google Images. Just type in gallstones, and you should be able to see these pictures. And I got it from this website. The quarter is there just to give you a reference to the scale of these stones. And when I did it for the first time, they were about like that big. So if the quarter is that big, this is kind of gives you a relative size of the stones. So the first time I did this, there was a lot of big stones, especially in the beginning. And later on, you see smaller stones and smaller stones. And then towards the end, you got this white sandy beach that came out. And once again, the colors of the stones really depends on what you eat. So please remember that. And when I did these flushes for people, people have sent me a lot of pictures, and they all scale around the same area. This is the other alternative. People removing, this is from the New York Post actually, people removing stones physically through this process. Do some people need to physically remove them using surgery? I think so. Does everyone have to use surgery to physically remove your gallbladder? The answer is no. And if I was advising my mom, my dad, people I really care about, I would do everything in my power to prevent them from having surgery to physically remove the gallbladder, because once you remove them, where are you going to store this bile? So therefore, you're going to have complications. And the best time to do this thing is the springtime, based on the circadian rhythms of not just the whole day that is very popular, but there's also a circadian rhythm based on the seasons. Like an example, when springtime hits in the vernal equinox, and if you're in the northern hemisphere, when your eyes see that light spectrum that's been missing through the entire winter season, your liver begins to wake up, and it prepares your body for the spring food that is up and coming ahead. So all the vegetables that like dandelion, the flowers that you're able to consume, and your body gets prepared to do this. And we see this evidence based on the microbiome of people who ate based on the seasons. And you compare the people who live in the cities, and the body adjusts. So we were meant to eat according to the seasons. And so springtime is the best time to do it. If you're young, up until the age of 50, it's still good to do it, any time of the year actually. But if you're in the elderly population, the best time to do it in the spring, because otherwise I've seen patients become very, very weak afterwards. It's not a pretty flush, I would say. And the flush that I do is a 2-day format. There's a lot of flushes out there that does it in 7 days or 5 days, sometimes 2 weeks to remove a lot of these stones. But what I found was that a lot of people are not interested in doing a flush for long-term commitment, because then you got to find the right time to do it, right time of the year. whereas a 2-day flush, you do it in over a weekend. There is a famous, the first lady of nutrition named Anne Louise Gittleman, and she is considered or hailed as the Yoda of holistic medicine. And her credentials goes very, very extensive. And she was presented with the Humanitarian Award from the Cancer Control Society in 2016 for her contribution of her work in nutrition therapy. And one of the things that she emphasizes is the importance of liver gallbladder flushes, exactly what I talked about. And I came across Anne Louise Gittleman's work because I was listening to the Ben Greenfield podcast. And the guy who introduced me to Ben Greenfield podcast was a guy named Tom. He's the partner at Primary Holistic Integrative Center in this company. And he sent me this because I was doing these, when he first started working here, he saw me give out these gallbladder flushes. And I was talking about the science behind it and the importance of it, and how this bile salts you need to help digest not only the food, but to have free-flowing bile salts or free-flowing bile, and the importance that after you digest these foods, these bile salts are recycled in the body to make your hormones, and especially in the conversion of your thyroid hormones, as well as estrogen, testosterone, and so forth. And there's a lot of scientific research that supports this argument. Now, if you type in liver gallbladder flushes, there are pros and cons, just like any research out there. There was a study back in, I forget what time period, but there was a study where they did it through before and after using sonograms, and they did find that there was less stones, which is a strong confirmation, but there has not been studies since then. And I guess the scientific community or the medical service industry don't want this information to get out, because gallbladder surgeries are very profitable from that perspective. So I think they put the kibosh on that real fast. And one way I know that this is true is that when you do the flush for the first time, you see these large stones come out. And if you do it successively, or like once a year, you'll see less and less bigger stones because they're not accumulating in the body to become larger. And that's one of my indications that this thing is actually true. But I put the link below, and if you're able to find, just type in Ben Greenfield liver gallbladder or gallbladder cleanse, and type in Anne Louise Gittleman. You should be able to find this podcast and listen to what she has to say. And she'll say pretty much the same thing that I'm saying. But to give you a synopsis of that thing is that, according to her, women in the U.S., fat, 40, and fatigued, are the people who commonly have this. Gallbladder removal is one of the most common procedures in this country. It's not considered an organ to throw away. You should do everything that you can to keep it. There is a unholy alliance, gallbladder and the thyroid, because having free-flowing bile helps you convert successfully your T4 into T3, just like I talked about before. And because the thyroid is intimately connected with the metabolism, and people who feel very sluggish due to hyperthyroidism, or very rapid, I should say, they're 7 times more likely to suffer from hyperthyroidism because their bile is very sluggish. And people who are in the keto diets, paleo diets, who are not eating carbs but a lot of fats, and if you're into the new carnivore diet, you might want to consider doing this type of flush because it's the essential fatty acids. Okay, and following up to this on a separate podcast is that Ben Greenfield does he himself, the host of the Ben Greenfield podcast, does the liver gallbladder flush, and he did his blood work before and after, and it shows that his boost in testosterone were to be higher up, as well as the liver fatty hormones or I forget the proper term, but the fatty liver issue. And there's a funny story. So I've been making this thing for my dad, and like many years back. So I would make it for him, and it's tedious work because you got to make it fresh and all that stuff. And I would make it for my dad, and I'm like, Dad, you know, you should do this. This is really good for your body. I care about you, and here. And then 3, 4 weeks later, I go to his house, and it's still sitting in the fridge. So I'm like, oh, you can't use this, and you know, you got to do it when it's fresh. So I would throw it out, and then my dad would say, make me for myself and my mom. So I'll now make 2 and put it in and give it to them, and they didn't do this. So that's the second time. The third time, I'm telling them, like, look, you got to do this. It's springtime now, and they still didn't do it. And the fourth time, after the fourth time I made it, because every time I go in, I see it sitting in the fridge after months, and I'm like, it's not fresh. You shouldn't do it. It's not. You should do this right away, not wait. And one day, my dad goes to go for his annual checkup, and he had fatty liver. And he gives me a call and says, son, I need you to make me the liver gallbladder flush. And I'm like, Dad, I made it for you, you know, 4 times, and it always sat there, and like, and you didn't do it, so I'm not making it for you anymore. I made it for you 4 times. And then my dad really got belligerent, like, you know, you're my son, listen to me, and all this stuff. And long story short, I didn't make it for him. And he did the flush, and he saw the stones come out, and he was shocked that what I was telling him was true. And a couple of months later, he went to the doctor, and turns out his fatty liver issue just, you know, disappeared right off the bat. So one thing I kind of understand from the liver gallbladder flush is that when you unclog these liver stones, and remember, they're not like really hard stones, they're mushy. And because they're mushy, they kind of like, your liver continues to absorb this little by little, and that's what makes your liver a little bit more fatty. So since then, my dad has done it several times, and I think by the time he did it the second or third time, he saw a lot less stones, and for him, it was a good confirmation that his body had less stones overall. So now I do this almost once every 2 years, or I try to do it every year, and that's pretty much it. So this is all the bibliography for where I get all this information to talk about this, and from my 10 plus years of clinical experience. So please feel free to reach out to me at 516-252-1484 and leave us a name. Give us your name and phone number to reach you, and we'll get back to you, and we'll send you with instructions, how to do the protocol, and just clear out 2 days out of your schedule to do this. All right, until next time, stay healthy, go forth, do good, and don't get caught doing bad. Take care.